So, hi Iain, thank you for taking the time to talk about your working group. You are chair of the first working group together with Søren Jepsen, which deals with the prevention of peri-implant diseases, including mucositis and peri-implantitis. So we are facing a huge prevalence of peri-implant diseases, and you showed a very nice picture dividing different phases of prevention yesterday. So where does prevention start and when does it end?
So prevention really starts before the implants are placed. So the picture really is some very nice work done by Clotilde Cara and Philippe Bouchard, and we worked on that picture, and what it demonstrates is the phases of prevention. It starts with something called primordial prevention, which means processes you put in place before the implant is placed, such as educating the patient, maybe looking at the presence of attached or keratinized tissue. Then, once the implant is placed, then you immediately introduce a risk factor because the implants don't shed, and so you have biofilm that accumulates on the implants. So in that situation, we move to primary prevention, and primary prevention is the prevention of the development of mucositis or peri-implantitis. Then, once the diagnosis is made of peri-implant disease, whether it be mucositis or implantitis, it's treated. And so following treatment of peri-implantitis, we then move to something called secondary prevention. In other words, once the disease is treated, how do we prevent the disease from recurring?
And this is lifelong as well?
Yeah, absolutely. And then we move to what we call tertiary prevention, which is preventing the complications of peri-implantitis, but we're not dealing with tertiary prevention in this workshop. We're limiting to primordial, primary and secondary prevention.
So, thank you very much. Best of luck for the voting in the plenary.
Thank you.